Today on Pennsylvania Newsmakers, we're talking all things consumer. Right now, we are in the middle of open enrollment for the Affordable Care Act in Pennsylvania. We'll talk about where the premiums are right now and what the future holds for open enrollment in Pennsylvania. This will be the last year as we know it for the system that currently exists in terms of enrolling for health insurance in Pennsylvania. And we're also going to talk today about cybersecurity. This year, there is one unique scam that's taking place online. And the most interesting thing about this, called e-skimming, is there's almost nothing you can do to prevent from becoming a victim. We'll be talking to a cybersecurity expert about that. All coming up today on Pennsylvania Newsmakers. Stay with us.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host.
And welcome to Pennsylvania Newsmakers. I'm Brian Roche from WGAL TV in Lancaster, Harrisburg, Pennsylvania, sitting in today for my friend Dr. G. Terry Madonna. Today we're going to be talking about consumer issues. After all, every single one of us is a consumer every second of just about every day. From the clothes you wear, to the cars you drive, to the selections that you make in the supermarket, we are all consumers. Today we want to talk about what will be, I'm told, the biggest cybersecurity threat to consumers this holiday shopping season. My guest today is Andrew Hacker from Harrisburg University, the president and founder of Thought AI. And I always like to acknowledge when we have Andrew on the program, the irony of his last name, but who better to talk about cybersecurity than a guy named Hacker? Andrew, welcome to the program.
Good morning, Brian. Yeah, I take my job very seriously.
I know you do. I know you do. This scam or incident online here is called e-skimming. A lot of people have never heard of it. Now, somebody like you, you know it's been around for a couple of years. Right. For someone who's just hearing about e-skimming or form jacking, how would you explain it?
Sure.
What is it?
Well, many people might be familiar with just regular skimming. If you go to a gas station, typically a thief will put some kind of device over the card scanner of a fuel pump, let's say, and that's regular physical skimming. So e-skimming is very similar, same general concept, although this is done electronically and this is on every website that's on the internet that does any kind of card reading or e-commerce. The basic idea is they do the same type of concept. They put some code on the web server of an e-commerce site that would actually skim your credit card as you're typing it into your browser.
Now, first of all, how do they do this? And why can't these big retailers see that it's there?
Right. Yeah, well, there's a couple things to think about here. One is the way the code gets onto the web server is the attacker finds some vulnerability in that company's website, either a vulnerability in the e-commerce code that they use, or sometimes they even get in the back door. Some of the most major breaches, like Target, came in from a third-party contractor. They actually, broke into the back-end servers of the system and put, malware or some kind of, bad code onto that server. So it's the same concept. They basically modify that web server that you see when you go to their site to inject JavaScript code, essentially, that tells your browser to take the card that you're typing in and send it off to, some remote site.
So the retailer can't see this. How does the consumer find out that they've been a victim?
Yeah, typically, the e-commerce sites do not see it. Eventually, they'll find out. Either they'll see some, aberrant traffic, or they'll, see lots of connections to, maybe some foreign country. But typically, the card companies will probably notice it first because they have some pretty sophisticated, fraud detection software that kind of triangulates and uses analytics to see your typical buying patterns. And if they see something, that doesn't fit the model, they might trigger on that. And if they see enough of these, they see thousands and thousands of, bad card purchases, they will be notified of that.
So this has been around since about 2015. I've been told this year it will be a, quote, major problem. Why all of a sudden this holiday shopping season?
Right. Well, I think it's just the prevalence of e-commerce and, paying electronically. I mean, even now with your phone, you can do AirPay or, just swipe your phone over, a remote sensor. So e-commerce is just getting, bigger and bigger. I think a percentage of, people that use e-commerce, now you might even get a drone delivering an Amazon package to you. But, certainly in some cases, it's a lot easier than fighting in traffic and going to a mall. So I think it's just the ease of e-commerce these days has gotten so great. So many people, are mobile, they are, online now. So, I think that's
so doing research for our interview here, our discussion, yeah. I read that nearly 2 billion people, that's 25% of the world's population, will be doing online shopping this year. So for anyone who thinks they may not be a victim, I guess, think again, right?
Right. Certainly, yeah, and it's very hard to detect. Certainly it's hard, if it's hard for the e-commerce sites to detect, it's certainly going to be a lot harder for the consumer to detect.
The big retailers, are they the ones that are most vulnerable to this attack, or smaller retailers who don't pay a lot of attention to their website? Are they the ones?
Yeah, that's a really good question. I mean, I think there's a trade-off. I mean, the larger retailers, they might have more funding and more budget in their IT budget for cybersecurity. I mean, typically you see 1 to 2 or 5%, but they're larger targets, right? No pun intended. That's where the big money is, right? So, if you can attack successfully a larger company, you have access to a lot more transactions and a lot more, consumers using their cards. Smaller retailers, they might not have as big a grab, so to speak, but they certainly don't have the budgets for maintaining their websites as well.
Okay, well, as we said, usually you find out you're a victim after the fact. When we come back right after this, we'll talk about how you might be able to prevent yourself from becoming a victim in the first place. Stay with us.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
And welcome back to Pennsylvania Newsmakers. I'm Brian Roche from WGAL TV in Lancaster, sitting in today for Dr. G. Terry Madonna. We are talking about e-skimming, the cybersecurity threat that you need to worry about during this online holiday shopping season. My guest, once again, is Andrew Hacker. Andrew, so this e-skimming has been growing rapidly the last 4 years. What can I possibly do to avoid it? You told me earlier that I don't find out I'm a victim until after I'm a victim. What can I do to possibly avoid it? Yeah,
on the consumer side of things, it is very difficult. The recommendations for cybersecurity for consumers is always make sure your antivirus is up to date, always use strong passwords, don't use, easily guessable passwords. But in this case, for e-skimming, it's the vendor, the e-commerce site that's being attacked. So, really from the consumer side, demanding that the companies that you use good cybersecurity policies, and they themselves follow the same practices that everybody's asking you to do. A lot of these breaches, believe it or not, have been weak passwords. In this day and age, for a large company that's taking credit cards online, to have a weak password is kind of really serious issue. So exactly.
So in doing some research for this, one expert I talked to said that apps, shopping through a retailer's app may be a little bit safer because the website is what's attacked. I wanted to get your reaction to that. Is it safer to shop on a website, or I'm sorry, an app?
Yeah, potentially. If you're just using a regular browser, then, a browser is kind of generic. You might think that an app that's designed by the same people that are, the e-commerce producers, like a Walmart or an Amazon, that their app is more specific to their e-commerce site. Maybe they have some additional security protections in there, but in the end, it's the same client application that's hitting that back-end web server. So, it's feasible that if there's e-skimming on the main site, the app could be susceptible too. So yeah, it's a mixed bag on that one.
What is a virtual credit card, and would it help me avoid becoming a victim in a case like this?
Yeah, that's a great question. Virtual credit card is essentially a one-time use card where you kind of like a one-time gift card or something like that, where you kind of load it up with some money, you make your purchase, and then after that purchase, that number ceases to function, right? So, maybe for large purchases, like, $1,000 or $2,000, you do it one time and then it's safe. I'm not sure it makes sense for a lot of small purchases because then, you have to redo it.
Contact my credit card company for that?
The credit card companies, are certain third parties that offer that as well.
Okay, so as long as you're here, you started to mention some of these things. I want to talk to you about privacy. It's a growing concern about privacy online, and I talk to so many people who think that while they're sitting there at their laptop, no one's watching. Nothing could be further from the truth, right?
Right. Yeah. I mean,
are we being tracked online? Is my question.
Yeah. I mean, the first thing to say is that there's a data explosion. I mean, there's so much digital information now about everybody, and more devices are sort of gathering data about you. I mean, certainly your phone is the first place, and your computer and what you do and what you browse online. I mean, it used to be that you would search something that you would want to purchase, and then every other site you'd visit, you would kind of see that same item there, right? And people started thinking, oh wow, are they tracking me? But now you can kind of take that to the next level. I mean, we've got devices in our home that we talk to help with our automate home tasks, like Google Home and Amazon Echo, Alexa, right? I mean, very, very popular these days. And the question comes up: are these devices listening to me? And it's a tough one. I mean, I've been in situations where I've been talking about something, and then I'll see something later that referenced what I spoke about. So. Yeah, I mean, there's no doubt that the amount of information out there about us and what we do and how we do things is very large. People do need to be aware of the possibility of being.
Okay, we have 1 minute. What can I do to limit that? What can I do on my phone? What can I do on my laptop?
Sure.
What can I do on my computer?
Yeah, I mean, the biggest recommendation from all these companies is go in and disable where it says help, this service improve, right? We're sending data to them so that they can kind of go through it and improve their services. That's how they always kind of, do the contract with you. You can disable that, whether they honor that or not. Most companies these days, larger companies, are starting to, acknowledge the fact that, people want their privacy. So they will listen, and hopefully, as more and more, controls will be, get in place, and even some, maybe some legislation down the road. So
I'm hearing data is more valuable than oil
Sure.
these days. No question about it.
That's true.
Andrew, thank you for joining us. We appreciate your time and your expertise. Coming up next, we'll be talking about healthcare in Pennsylvania. It's healthcare insurance buying season. Stay with us. We'll be right back.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
And welcome back to Pennsylvania Newsmakers. Once again today, we're focusing on you, the consumer. Right now, we are in the middle of open enrollment for healthcare in Pennsylvania. And here today to talk about that is Dave Buono, who is the Senior Advisor to the State Insurance Commissioner, the Consumer Liaison. David and I have worked together on a couple of stories over the years with the Pennsylvania Insurance Department. So Dave, we're right now in the middle of open enrollment till December the 15th. Let's start with the good news. Where are premiums at this year?
Well, I tell you, premiums this year are relatively flat to years past. One thing that we're pretty proud of is how stable Pennsylvania's market has actually become. We are at the all-time low of 5.5% uninsured. We've gone from having 20 counties in Pennsylvania with one insurer to now only 6. And numbers-wise, that's 180,000 people down to 9,000 people. That's a lot more folks that have choices.
And after years of double-digit premium increases, where are we at again now?
It was averaged about 8% this year.
Okay. Let's talk about subsidies. Who qualifies for the subsidies when applying for health insurance?
It's a great question because over 80% of Pennsylvanians actually qualify for subsidies. There are actually, I had read a report the other day from the Kaiser family that had said that 23% of the uninsured actually qualify for a $0 bronze plan. That's like 74,000 people right now in Pennsylvania that are uninsured that could get a plan at a 0 premium. So I'm glad you're having us here today so we could tell folks to get out and shop for insurance.
Till December the 15th.
Till December the 15th.
Now back to the subsidies. If you don't qualify for a subsidy, are you still unfortunately looking at a pretty substantial price hike?
You are looking at not necessarily a price hike, but you're looking at paying for that full price for the insurance without the assistance. And there are things that we're doing here in Pennsylvania to try to help those Pennsylvanians that are experiencing that high value of the insurance.
As we know, the Trump administration ended the requirement for people to have insurance or face a tax penalty. So with that, I ask you this question: where's enrollment at this year? Are the numbers down, steady, up?
You know, unfortunately, right now the numbers are down. We are watching it daily, hoping that they will start to spike up because, you know, health insurance is one of those things. You know, by going uninsured, you're rolling the dice with your health. And you never know what's going to happen. Nobody plans on waking up and going, boy, I'm going to fall down today and break my ankle.
Right.
You know, so being uninsured is really a dangerous gamble. So I'm hoping that those numbers being down are just folks getting a little bit slow to the start, and I'm hoping the next 15 days will really start to ramp up those enrollments.
Why are people hesitant to sign up for the insurance? Is it the cost? Is it the uncertainty? What's the reason?
You know, it's a great question, and I truly believe I wish it was one answer, because then we could solve it. I think some of it is folks believe it is too expensive. I have spoken to so many Pennsylvanians throughout the state that tell me, oh, I can't afford that because TV said so. And then when they sit down, they do a price comparison of plans that are available, they see, wait a minute, I can afford health insurance. And I've actually seen people cry because they can get health insurance because they hadn't had it for 10 years. So, you know, there are tools available on our website to help folks price compare plans where they can see the subsidies that would potentially qualify for them. There's places on our website to help people find help. You are not alone with doing this. It can be overwhelming. It can be confusing. Sometimes I think folks don't sign up because they think it's too hard, but there's help out there. So, you know, I think there are a number of reasons, and I also think folks procrastinate sometimes. They wait till the very end before they do it.
That's usually the case with insurance. Okay, so we're going to take a break now, but when we come back, we're going to talk about some big changes in store for next year in Pennsylvania when it comes to buying health insurance. Stay with us.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine, and by the Pennsylvania Healthcare Association, the future of long-term care.
And welcome back to Pennsylvania Newsmakers. We're talking about open enrollment for health insurance under the Affordable Care Act. My guest once again is David Buono with the State Insurance Department. David, big changes on the way next year. So there was a law signed this past July. Tell me about that. What's that going to mean for me as a consumer?
Well, I tell you, the law is amazing because it was a completely bipartisan law that passed here. What it's going to mean for consumers here in Pennsylvania is better customer service at a lower cost. And it's Pennsylvania helping Pennsylvanians versus the federal government working with Pennsylvanians. So we'll be able to do things that are state-specific, that are community-specific, that we can really drill down and help Pennsylvanians with getting health insurance.
And speaking of being specific, let's be specific. The state is going to start running its own health insurance exchange next year, correct?
Yes, that's correct, for 2021.
And how is the state preparing for this? This has been something that the state has wanted to do for quite a while, hasn't it?
It is, and the way that we're preparing is, you know, currently we have the state-based exchange has its board together. The board is working through and getting partnerships. Like, if you don't mind, recently we formed a fantastic partnership with Get Insured, which is going to help with the technology and customer service of the state-based exchange.
So the state themselves will not be running this per se. This partner will be helping out.
It'll be in partnership with. So the state will very much be part of working with Get Insured to make sure that we're reaching Pennsylvanians the way that they need to be reached.
Pennsylvania is a bit of a pioneer in doing this. There's only, as I understand, only 11 other states plus Washington, D.C. that are operating their own independent marketplace. Why are other states not doing this?
You know, I think there's a combination of reasons. I can't really get into why other states do it. You know, what I know is that we look at it knowing that we can do a better job here in PA.
So how does this benefit me, Joe, the consumer? What is this going to mean for me? Better premiums, more choice?
Yeah. With the savings that we get by running our own exchange, we're going to be able to put affordability mechanisms in place that will assist with those premiums.
Okay. You mentioned Get Insured. That's a platform provider. It works in a couple other states, right? They're already working in other states?
Yeah, it's in Nevada, Idaho, Minnesota, California, and Washington, I believe.
To take a half a step back, I did read somewhere that Pennsylvania having its own exchange could save Pennsylvanians up to $250 million a year. Does that number sound familiar to you?
There are various ways that it will save Pennsylvanians money.
Okay. And when does this go online?
It goes on the technology
when
itself.
When does Pennsylvania switch over to the new exchange, its own exchange?
2021.
January 1st of 2021.
So we want to make sure that folks don't forget that Pennsylvania is still using healthcare.gov. Healthcare.gov is important because unfortunately there are a lot of sites out there that maybe will send folks in a different direction. And if folks need help, they should absolutely go to insurance.pa.gov. We have a ton of information there to help.
Okay. As long as you're here, I want to talk about one of my favorite subjects, what I call the insurance checkup.
Okay.
I don't want to say every day, but quite often I'm talking to consumers, my viewers, who have had a very unfortunate circumstance learning about the value of insurance. And I promote something called Insurance Checkup, which I think you guys first told me about in the insurance department. Explain that. What's an insurance checkup and how often should you do that?
Well, I tell you what, you should do it at a minimum every year. And what an insurance checkup is taking a step back, looking at the different insurance policies you have and making sure that you have the right coverages for you at that time.
Okay.
And that includes looking at auto and homeowners and even your health insurance. Even though health insurance open enrollment November 1st to December 15th, you still need to keep track of that. And other insurance policies. You know, things change as life goes on. Even life insurance policies, you know, things change, so it's always a good idea to take a look and look at what you have in regards to insurance.
I think you'll agree with me with it. When you mention the word insurance, most people, their eyes roll back in their skull. It's the last thing they want to talk about because it's the one product we need, but we hope we never, ever have to use. Another example that I cite is people, if you do remodeling or renovations on your home or property, the value of your home changes, right?
Absolutely. When you do those remodels, you should tell your insurance company about it because it'll impact the value of your home, which could impact what you're paid if, heaven forbid, something happens at your home. So any kind of renovations you do, or if you get a new car, be sure to tell your insurance company you got a new car. Be sure that you have it insured properly. You know, those are things that you always want to keep track of. And you're right, folks do, their eyes roll back in their head, or sometimes they just kind of cringe, which makes me sad because it's fun stuff to talk about.
Fun to talk about insurance, huh?
Yes, but you know, they should absolutely check it every year.
What's the one thing people misunderstand about car insurance? We have about 1 minute, but that's what I talk to people about the most. They found out the hard way they didn't have enough coverage. What's the one misunderstanding they have the most? You
know, I believe that a lot of folks feel that when they purchase insurance, it covers everything. They don't pay attention to the policy limits that are attached to their policy, you know, so they'll think that it's going to cover everything that involved in an accident, but if they only paid up to X amount, the insurance company's not going to cover more. Okay.
I always advocate people do their insurance checkup in January when you're sitting inside in the cold weather and have nothing else to do.
It's a good idea.
David Buono from the Pennsylvania Insurance Department, thank you for joining us today. And thank you for joining us today here on Pennsylvania Newsmakers. I'm Brian Roche from WGAL TV in Lancaster, sitting in today for Terry Madonna. Have yourself a good weekend. Take care.